What is a panic attack? Symptoms, causes, and remedies. A panic attack is defined as the sudden onset of intense anxiety, discomfort, or fear. It comes on quickly, lasts about 10 minutes, and in many cases doesn't seem to have a direct cause. Physical symptoms that can accompany a panic attack include dizziness, feelings of shortness of breath, and sweating. There are two types of panic attacks, unexpected and expected. An unexpected panic attack is just that there doesn't seem to be a cause or a trigger that the person experiencing the attacks can pinpoint. In contrast, expected panic attacks are those preceded by something. For example, if a person with a phobia of spiders sees a spider. Meanwhile, when the fear of having a panic attack brings on an actual attack, that attack is said to be caused by anticipatory anxiety. Panic attack versus panic disorder. Having just one panic attack doesn't mean you need to see a doctor immediately. But having several of them suggests a visit with a medical professional is in order, as they can indicate a more serious condition at play, such as panic disorder. Panic disorder is often diagnosed when a person has recurrent 2 or more and unexpected panic attacks, fears a future attack, and or has changed their behavior to avoid a future attack, has panic attacks not caused by the effect of substance, such as drugs, has panic attacks not explained by another disorder, such as social anxiety disorder or agoraphobia. While panic attacks themselves aren't truly dangerous to your immediate health, they are sometimes associated with more serious long-term problems. For example, people who have panic disorder are more likely to have a substance use disorder and are more likely to attempt suicide. A pattern of a panic attack and the presence of related mental health problems, such as substance use disorder or post-traumatic stress disorder, indicates a more serious underlying problem that must be treated to minimize panic symptoms. Symptoms of a panic attack. A panic attack is defined as the presence of at least 4 of the following symptoms: fear of dying, fear of going crazy, feeling as though they're outside themselves, chest pain or discomfort, dizziness, and sense of choking, hot flashes or chills, nausea or upset stomach, numbness or tingling, heart palpitations, feeling short of breath, sweating, shaking. Easing panic attack symptoms in the moment. If you're experiencing symptoms of a panic attack, there are a few things you can do, some of the most effective and easy to use in the moment. Techniques fall under what is called grounding and regulation. Grounding activities your sensory experience to slow your racing heart, breath, and mind. One technique is to blow out of an invisible straw for a count of at least 5. for as long and slow as you can. Repeat until your heart rate slows down. Another way to ground and regulate the nervous system is to focus on your physical experience. Our minds have the luxury of time travel. We can worry about the past and the future. The body doesn't have that luxury. The body is right here, sitting in this chair. This exercise to reconnect with the physical. Number 5 things you can see. Name 4 things you can physically feel in your body. Maybe pick up an ice cube. Notice if your shoes are pinching your toes, or notice the temperature of the desk that your hands are on. Name 3 things you can hear, and if you don't hear anything, do something that makes sound. Run the water, speak out loud, or play some music. Activate your sense of smell by using scented oil or lotion. Activate your sense of taste by chewing gum or drinking a flavored beverage. What causes a panic attack? Many people who experience panic attacks say they can identify the cause or the trigger of the attack. Others trace their symptoms to things like a stressful situation, like a divorce or job change, withdrawal from drugs or alcohol, caffeine consumption, poor sleep. In addition to psychological factors like a stressful situation, evidence suggests chemical changes in the brain and nervous system are responsible for the feelings of intense fear and other symptoms. These changes may be genetic, meaning they're passed down from parents to children. They may also be exacerbated by a lack of sleep or exposure to drugs, alcohol, or other toxins, as noted previously, or they may be caused by a combination of factors. This evidence is consistent with his experience. I observed that poor sleep or family history of panic or anxiety disorders renders anyone more likely to experience these symptoms. Risk factors for panic attack. This system includes the brain, spinal cord, nervous ganglia, blood, and connective tissue, and controls everything your body does. The nervous system is carefully balanced and sensitive to change, such as those caused by sleep quality or chemical found in drugs, alcohol, and certain foods. Change caused by other diseases, such as asthma or diabetes, can also affect the nervous system. Factors that are associated with panic attacks include long-term exposure to stress, having a personality that reacts strongly to new situations and people, being prone to anxiety. Remedies for a panic attack. Counseling, specifically cognitive behavioral therapy or CBT, is the most effective treatment for panic disorder. CBT is a type of counseling in which a therapist helps a person change the ways they think and how they behave. Counseling may be used alone or in combination with medication. Benzodiazepines may also be prescribed, but they're used less often because they're more likely to be abused. Physical activity has also been shown to be an effective remedy for the symptoms of a panic attack. There are other complementary and alternative treatments for panic attacks too, but there is a lack of high-quality evidence to support their use, and they could interfere with medications. Be sure to discuss your treatment options with your doctor. When to see a doctor. One panic episode may be a fluke, but 2 episodes is a trend and should alert the person that there is something they don't understand and should seek professional help.